Hi, I'm Dr. Rajani. Today we're filling the under eye. The exact thing I tell you not to do, and we're doing it today. I'm going to show you some video footage of filling the under eye, show you the points that I look for. We're going to look at a before and after. I'm going to show you how I measure results and look at why maybe you shouldn't fill the under eye, but why everyone wants it. And I'll show you also how we add up some threads and we do some neuromodulators. And I know fractionated RF, radio frequency, people think it's dissolving their face, and certainly it can. I'm going to be combining a radio frequency under eye treatment today along with the filler, the toxin, and the threads. We don't want to dissolve the under eye unless it's exactly where that bag is, the baggy under eye that creates a dark circle, or people feel like it creates a heavy under eye that makes them look tired even when they're not. So I'll show you a quick little footage from this. Now, this is something I teach on my Aesthetic Monthly Insider Training, and I took this from that course to show you what's involved. And when we look at the before and after, we're going to look at how we measure the results. It's the same way I measure results for my plasma eyes procedure, or PRF, platelet-rich fibrin, the blood draw, all natural procedure, to see what results we're getting at over time. Because of course, I would much rather use someone's own stem cells and growth factors to help rejuvenate the area for a couple reasons. And one of them is, it doesn't draw water in if you use your own product. This product I'm going to show you today is one that tends not to draw water in. It'll be Restylane Contour that we're using in a microcannula technique. As well, the lymphatics play a big role. So if you use a high G prime, a strong filler around the eye, you have two main chains of lymphatics around the eye, and if you disrupt them, it can make it worse. Many people here are going to ask me, how do I get rid of the malar bag, or that somewhat lateral bag around the eye region? And really, of course, there's superficial and deep fat pads, and a lot of people think that's a demarcated fat pad from the ligaments, but it's actually not. It's fibrous tissue that's just below the skin, and it collects there. So it's a little different than what people call the tear trough. And the tear trough is somewhat of a misnomer. Very complicated. To keep it simple, let's look at a couple of injections here. You see that I'm using a microcannula technique. I'm coming from inferior. I mark out some very important points that create a lifting effect, and then we pop through a couple of the ligaments. There's three main ones around the eye. These are all things I teach in depth. Now, people go to get their under eye filled, they're worried about blindness, they're worried about having to get it dissolved, they're worried about it looking unnatural. All those things can happen with me and with any other injector. Injectors that are watching this course and others will watch the same lesson 3, 4, 5 times. That's what goes into learning these procedures, and they'll watch many other teachers do it. So understand, it's extremely complex. It's not something you learn in a weekend or even over several months. It's over a career and a lifetime, and we always change our techniques. Here I'm injecting the other side of the face, and of course we're trying to get the right to equal the left. The sides of the face are not identical twins, they're sisters, they're not twins. So meaning there's little subtle differences, and one side might be much different than the other. So understand, when you come in, symmetry is something we always work towards, but one eye is often deeper in the hollow than the other. And the elephant in the room, dark circles aren't always about filling. They're from brown spots, like we talked about lymphatics, they're from red or rosacea or vessels. So all those things. So there's many elements to the dark under eye circle. Filling is but one component. Here, just before I filled, I use a radio frequency fractionated RF that you know I like RF because lasers pick up pigment in the skin or other pigment. Radio frequency doesn't see color in the skin, rather it's electrical energy, so it's safer. Everyone's going to be worried that you're going to lose the fat. Like I mentioned, understand its settings. Just like I talked about the amount of training that goes into filling an under eye or treating an under eye in any way, the same amount goes into your your treatment with radio frequency, because yes, I use it to get rid of fat in the lower face. I don't want to get rid of fat in other parts of the face. So I even use a completely different device. And for the home gamers out there that are asking, hey, is there a radio frequency or an high frequency ultrasound HIFU device that you recommend? Understand, I have 5 different ones in the clinic for different areas, and they're all medical grade. And it's taken me about 200 treatments to really get to know each. So it's really hard for a home gamer to kind of fine tune and get those results, and the output power of those is going to be different. So, but the point of it is, I'm not just filling the under eye, I'm also using energy, and I'm going to use, as here, injections of BOTOX and threads. We actually use dysport in this patient, and threads to get that eye lateral lift. So if we look at the after picture on the right, you see some redness. That's from Viora's fractionated radio frequency. I used a short pulse duration so we get the superficial skin. We still will get some elastin and collagen stimulation, but we're not targeting the deeper fat, and that's key here. Now when you see that redness, we know we've disrupted the outside of the skin. Initiate that healing process. What are we going to use? Growth factors. The Anteage system is what I send everyone home with, because it makes me look better, because they get a better treatment, but most importantly, the healing times are much better. Patients heal up quicker, and the growth factors are signals, of course, that tell the body to heal properly, to arrange that collagen in a smooth network as opposed to irregular. And so the Anteage system is something we can use, the serum and the accelerator, which I have patients use daily. Of course, there's a retinol-like compound in the bakuchiol. However, there's also a brightening solution that this patient would benefit on, because there was that brown area below the eyes, whether it's melasma or whether it's because she did not use sunscreen below the eye. That's another common reason. The brightening solution attacks the pigment and the pigment formation in 7 different pathways, as well as having growth factor in it and tranexamic acid. So I think I'll do a whole video on that, but understand skincare is a big part of the healing and the results, and it is something patients can do at home. I'm showing you why people choose fillers over what many people should do, which is platelet-rich fibrin. It's that instant boom effect. So if we look here, you see she just has a lifting of that cheek. If you look laterally, just looks more attractive, more youthful, more lifted. And in fact, that anterior projection of the cheek and that filling of that lid cheek junction, which some would call the tear trough, it's kind of an in look. It's a little more youthful and attractive, has a sexy look to it. So a lot of people want that pop. Now, if we come and we go to this picture, what this is showing you is the yellow represents increase in volume. This is immediately after the procedure, and I'll stop it here so you can see when we have more yellow, it means there's more volume. We just added half a vial per side, which is 1/5 of a teaspoon in total. So 1/10 of a teaspoon per side, and this 3D camera picks it up. What does that tell us? One is I can follow and see how long the filler result lasts in this location, or is it even maybe migrating? The other thing is understand with platelet-rich fibrin or PRF, I can tell what results we're getting over time because I'm measuring my patients who I'm doing PRF in, plasma eyes PRF, and now we're doing PRF gel treatments, which is much more like a filler result because it has some G prime, because we're heating the albumin to create a gel and putting the PRF back. So this is evolving and improving. However, I can measure it so I know what the PRF is doing and is it equating the results of filler. And so you can watch my plasma eyes and my upcoming plasma fill and gel filler PRF videos as we make them. But know that we measure and know that we look at the measurements to make sure what we're doing. Imagine if I saw increased volume immediately down in the lower face where we don't want it, or if I saw increased volume up in the lid. Now in Korea, in certain countries, they are now filling the lid. They like that look. but we're not typically in North America. That isn't the look. But if I did see it there, I'd be concerned it migrated up, or if the filler went to the nasal fold. So we can measure that. So you see how complex it is. You see how clinics think and what goes through the mind of your injector, especially for home gamers that are filling themselves at home, or you're going to someone's house to get your product or get your filler or your toxin, or you're trying to save money by going somewhere where it's half the price. Typically you're not getting real product, or people really aren't educating. This costs money, it costs money to your clinic. So the before and after gives you an idea of what we look for. Remember, any treatment has side effects, from blindness to migration, and if you dissolve this, I did a complete video, I have about 4 or 5 of them on dissolving fillers, some of the pitfalls and what's involved with dissolving. Now if you use platelet-rich fibrin, we're using the stem cells and the growth factors to help plump and rejuvenate the fat pads, make the lymphatics better. It will not get the surface browns, but it will make those fat pads better and affect those changes over the period of weeks to months, and often you need a second session. The reason a lot of people choose the fillers is it's boom, boom, now. And a lot of people like boom, boom, now. And there's a lot of satisfaction. But as practitioners, we need to also temper this with the long-term benefits of not using fillers. This is a young person, good skin. We only did a half a vial on each side. And I know probably for the future I can get away with just PRF and keep her satisfied because she has that initial hit of the fillers. If the skin was not good, if it was, meaning the dermis wasn't thick, if it was very thin, translucent, I would insist I would not do fillers. I would do at least 1 or 2 sessions of PRF before I would do the filler, and I would deny the patient fillers until they did the PRF, or at least some device to make the skin better, because the chance of the fillers working well decreases from probably 95% for me in this case with this person to less than maybe around 80% satisfaction. And if you think, you go, oh, Rajani, 80% is pretty good. Well, if you think I see 10 patients in a run of a day, that means 2 are not getting a good result. That's very high for a day. So we need, unfortunately, 95% plus satisfaction, or at least we're striving to. That still means in a week, 5 people won't be happy. So understand satisfaction. There's no way. In aesthetics, a good number is 80 for all comer, all practices, all things. And in the studies, 80% is a pretty good number. That is tear trough filler. We've talked so much about it recently. I wanted to show you a case. Tell me what you think. I put a complete playlist up here for things you can do at home to keep your skin and body beautiful, healthy, and vibrant.